Hi, my name is Manali Andrus. I'm a pelvic floor physical therapist here at Legacy Physical Therapy, and today I wanted to talk to you guys about something called chronic prostatitis. This is something that actually impacts about 50% of men at some point in their lifetime. So it's a pretty big deal. That's a large percentage. And so a lot of people don't know that pelvic floor physical therapy can actually help with this. And so before we dive into how we can help with that, I wanted to kind of backtrack a little bit and talk a little bit about what chronic prostatitis is and prostate gland in general. The prostate gland is actually responsible for creating creating the fluid that goes into the semen, and the gland is located near the urethra. It wraps around the neck of the bladder. And so, based on its positioning, we can already kind of tell that it's going to have an impact on bowel function, bladder function, and the pelvic floor itself. There are two kind of broad categories of prostatitis. One is acute and one is chronic. So acute is when the symptoms can be treated pretty quickly with antibiotics and the symptoms go away and don't come back. Chronic prostatitis is when the symptoms are present, come and go, or fully present for at least 3 months to be categorized in that chronic category. There are four main types of prostatitis. You have acute bacterial prostatitis, and so this is where the symptoms come on pretty quickly. You have antibiotics that can treat it, and it goes away. Chronic bacterial prostatitis is when there are the symptoms present, but there's a bacterial infection that is also present, but it tends to not go away. It's been lingering for a little while. It might feel like you have multiple UTIs, but it is a bacterial infection that is present. Type 3 is when what is called chronic prostatitis, also known as chronic pelvic pain syndrome. And this is the one that we really want to highlight today because this is the one that can be treated with pelvic floor physical therapy. There is inflammation that is present, but there is no bacterial infection that is present. Type 4, which is interesting, is asymptomatic inflammatory prostatitis. And so this is where most people don't even know they have this. There are absolutely not really any symptoms present, but there is inflammation that is present. But type 3, the chronic prostatitis, also known as chronic pelvic pain syndrome, is the one that can be helped with pelvic floor physical therapy. So that being said, the most common symptoms of chronic prostatitis type 3 is going to be any pelvic or genital pain. So sometimes there can be heaviness, sharp shooting, or aching symptoms that are present through the buttocks, the inner thighs, pain in the pelvic floor itself, in the penis, the testicles, anything really in that general pelvic region. You can have bladder frequency, urgency, difficulty emptying the bladder, but you can also have bowel issues such as pain with bowel movements or constipation that's present. There tends to be sometimes pain with sitting, pain with exercising such as squatting or lifting, or pain with sex. And so a referral to pelvic floor physical therapy is actually really common with this, which is awesome. Tends to be one of the first line treatments for type 3. And so when we have a patient that comes in with this diagnosis, typically the exam is gonna look like first looking at your core muscles, your hip muscles, your back muscles. So looking at the things that surround the pelvis to see if those things can be impacting the prostate gland and the pelvic floor in general. And then it will also involve a pelvic exam. This looks really similar to how they test your prostate at the urologist's office. And so based on what we're finding on the exam, what we typically see is that the pelvic floor muscles with that exam they're in a state of elevated kind of tension and tone there. And so we work on exercises to reduce that tension. We also work on if there's core weakness present, back weakness present. We strengthen all of that to make sure that there's not added pressure on the prostate and the pelvic floor in general. And so with that being said, if you feel like you've tried a different treatments for prostatitis and feel like you're not really getting anywhere, you're still having these lingering symptoms, ask your doctor about pelvic floor physical therapy and come see us at Legacy. Have a good day.